The next topic is the neck. The neck, it is roughly quadrilateral in outline. So this quadrilateral space, we divide it by the sternocleidomastoid muscle. So this sternocleidomastoid muscles divide it into the anterior and this one is the posterior triangle. So what are the boundaries of the neck? The neck, it is bounded anteriorly by anterior median plane, the posteriorly by this anterior border of the trapezius muscle, the superiorly this superior region by the base of mandible, and line joining the angle of mandible to the mastoid process, and inferiorly there is clavicle. What is the nerve supply of the skin? The skin of the neck. What is the nerve supply of the neck? The skin of the neck, it is supplied by second, third and fourth cervical nerves. The anterolateral part, it is supplied by anterior primary rami through the anterior cutaneous, greater auricular, lesser occipital and the supraclavicular nerves. Remember the first cervical nerves has no cutaneous distribution. Also the cervical 5th, 6th, 7th thoracic first nerves, they supply the upper limb through the branchial plexus. Therefore they will not supply the neck. The fascia. Coming to the fascia means fibrous connective tissue that binds together the various structure of the body. The fascia are of two types. One is the superficial fascia and other is the deep fascia. The superficial fascia, it is the subcutaneous present just below the skin, whereas the deep fascia, it is present around the muscles, blood vessels and the organ of body. The deep fascia around the neck is known as deep cervical fascia or fascia colli, as it forms. Why the name fascia colli? As it forms a collar around the neck. So this deep cervical fascia, it lies deep to the platysma muscle in the interval between the muscles, vessels and organ of the cervical region. It also gives extension or lamina around various structure of the neck. It has 7 modifications: investing layer, pretracheal layer, prevertebral layer, carotid sheath, buccopharyngeal fascia, temporal fascia and pharyngobasilar fascia. The first is the investing layer. It lies deep to the platysma and surrounds the neck like a collar and forms the roof of the posterior triangle of the neck. What are the attachment? Superiorly there is external occipital protuberance, superior nuchal line, mastoid process, external acoustic meatus and base of mandible. The superficial lamina between the angle of mandible and mastoid process, the fascia will split to enclose the parotid gland. The superficial lamina is named as parotid fascia. It is attached to the zygomatic arch. The deep lamina, it is thin and is attached to the styloid process. So between the styloid process and angle of mandible, the deep lamina, it is thick and it forms the stylomandibular ligament that separates the parotid gland, this parotid gland from the submandibular gland, and it is passed by the external carotid artery. At the base of mandible, it encloses the submandibular gland. The superficial lamina, it is attached to the lower border of mandible and deep lamina, it is attached to the mylohyoid line. What is suprasternal space? It is formed by splitting of the investing layer of the deep cervical fascia at the upper border of the sternum that gets attached to the anterior and posterior border of the suprasternal notch. It encloses a space that known as suprasternal space or also known as supraclavicular space. So what are the content of this space? It contains supraclavicular nerves and external jugular vein. So the suprasternal space, it contains the sternal head of right and left sternocleidomastoid muscles, the jugular venous arch, lymph node, and it is traversed by the external jugular vein and supraclavicular nerves. So it forms a pulley that binds the tendon of digastric and the omohyoid muscles. It forms the roof of anterior and posterior triangle. The division of the external jugular vein in the supraclavicular space that may cause air embolism and consequent death, because the cut end of the veins they are prevented from the retraction and closure by the fascia. Pretracheal fascia. So this pretracheal fascia, it suspends the thyroid gland and forms its false capsule. The posterior layer of thyroid capsule, it is thick on either side. It forms the suspensory ligament for the thyroid gland that is known as ligament of Barry. The ligaments they are attached to the cricoid cartilage and extends to the thyroid cartilage. They support the thyroid gland and do not let it sink into the mediastinum. Prevertebral fascia. It is one of the lamina of the deep cervical fascia that arises deep to the sternocleidomastoid muscles. It lies in the front of cervical vertebra and muscles in the front of it. Horizontally, it forms the floor of posterior triangle and finally extends up to the axilla, the axillary sheath, enclosing the axillary vessels. Vertically, it extends from skull base up to the fourth thoracic vertebra. Due to the extension of the vertebral fascia, as the axillary fascia infection of the vertebra carries spine, that is the tuberculosis of the vertebra, that may lead to spread of the pus to the axilla. So the prevertebral fascia, it forms the posterior wall of the retropharyngeal space, and the retropharyngeal abscess will cause dysphagia. So the infection in the retropharyngeal space, it can spread to the mediastinum. The carotid sheath, it is a fascia. It is a facial sheath that is situated deep to the sternocleidomastoid muscle on each side of the front of neck. Anteriorly, the wall is formed by pretracheal layer of deep cervical fascia, and posterior wall is formed by prevertebral layer. The contents, it contains internal jugular vein, laterally common carotid artery in the lower part and internal carotid artery, medially vagus in between them in a posterior plane. Anteriorly there is ansa cervicalis, posteriorly there is sympathetic trunk. So what are the contents of carotid sheath? That is important. The content are common or internal carotid artery, internal jugular vein, vagus nerve, it is thin over the vein. In upper part of sheath there are 9th, 11th, 12th nerve also. Buccopharyngeal fascia, it covers the superior constrictor muscles externally and extends on the superficial aspect of the buccinator muscle. Pharyngobasilar fascia, this fascia is specially thickened between the upper border of superior constrictor and base of the skull. It lies deep to the pharyngeal space.